Good morning, the Ridge Medical Practice. Vicky speaking.
Now I'm going to go into full lecture mode.
Please don't give me a lecture, because I know all about it.
She keeps coming out in like these little spots, but she's having black poos.
It's my past urine, it smells horrible.
How long have you had the smelly urine for?
Oh, too long.
And I found that I was having some menopausal rages, particularly with drivers.
I'm really proud to work at the Ridge. Yeah, I am.
I feel that working in the Ridge is a bit like a big family.
It feels that way, and literally, loads of us are married to each other.
One of the things that I really like about my job is how varied it is.
No 2 days are ever the same.
You never know what's going to hit you.
We have all sorts of characters coming through the door with different stories to tell.
There's all different cultures and all different languages.
We have to be ready for all sorts.
We can get anything from a cough and a cold to a cardiac arrest, and it just seems to be all in a day's work.
The next thing you know, it's 6:10, and you think, gosh, where did today go?
Come in. Come in. Oh, sorry, I've no
Hello, Doctor.
How are you doing?
Well, Professor, isn't it?
Oh, God. Yeah, come
I'm honoured, right.
How are you doing?
All right.
You
I'm
enjoying
okay,
the
actually.
weather?
Bit warm.
It's warm, isn't it?
Why I've come to see you is this only takes 60 units.
Yeah, and you're on more.
Well, yeah, I managed to cut down, but I don't know how long it'll last.
OK.
So if I have to go over 60,
Yeah.
it means 2 injections.
Yes.
Have you got another?
Let me see. I don't think it does. This particular insulin only comes in this pen. You can get cartridges,
Yeah.
but they would only fit the same kind of pen.
With the same amount
Yeah.
in? What about changing my insulin?
Well, the problem... It's up to you. OK, so your diabetes at the moment is quite well controlled, and it
Yeah.
has been for some time.
Yeah, it is. It's not bad, yeah.
We can try and find an insulin that's similar to this, but a lot of the pens for a lot of the insulins are exactly the same
Still on
as this.
60.
Yeah.
But I'm managing my diet a little bit.
Good. Because that was the other thing we talked about last time, is that
I mean,
sometimes
if
you had a bit of cake and ice cream and...
I know, I've cut them out. Apart from pudding she brings in now and again. Shouldn't do, but there it is. But...
Right, you can blame me.
Come in.
Hello, are you OK?
It's a cracking knock you've got, Stephen.
I know well. Don't want to mess around, do we?
So, Dr. Harris, hi. How can I help you?
I've got like some lumps on the back of my neck, which initially I thought was like an ingrowing hair because I shaved my head.
Yeah, yeah.
But it didn't manifest itself like that. And then I've come back from holiday,
Yeah.
and it started to go red. Now I went to the chemist.
Yeah.
To see if I could get some cream, and he looked at it and said he thought it might be infected and to come to the
Some antibiotics,
come and see
possibly.
the doctor. I have been using like an antibiotic cream that I got in Turkey.
So how long did you have the spots before you got
I've had them probably 2 months.
Right, OK. So
and
let's
it's
have a
not,
look.
yeah, I'll take my coat off and you see a little bit.
Yeah. And you've not been bitten or anything like that?
No, I don't think, well, I don't think so. It's more hard. The spot's more of a solid spot and nothing comes out of it.
It's certainly fit with a folliculitis, which is an infection in the hair follicle, which you get probably because you shave your hair.
Yeah.
So you have a tendency to get that. But then this has clearly got more infected on top. So you need some antibiotics, and you need a good course of penicillin. You're not allergic?
No, not to my knowledge.
So if you take that, that will settle it down quite well.
But what's going to happen to the... Do I just have to live with the spot thing?
Well, they'll calm right down with the antibiotics.
Yeah.
And then you really just need to just be careful with the shaving. And sometimes just some antiseptic that you can use in that area.
Right.
But it is a tricky area to... Right. Because what you're doing is you're blocking the hair follicle because you're shaving off their hair.
Yeah.
And then it just gets a bit infected. So if you keep antiseptic on, usually works. Sometimes medicated talc helps. Right. And that dries it up, but it's also... will treat it as well.
Right.
So try those couple of options. But it's flucloxacillin you need.
And maybe let my hair grow.
if you want to.
I
Yeah.
don't think so.
Hey?
I end up looking like Coco the Clown.
You've got to grow a ponytail. That's my advice.
Yeah, well. Right, thank you.
Let's wait for this.
Oh, God, yeah, I forgot.
Don't jump ahead of the printer.
Yeah.
So take the whole course, 10 days.
Yep.
And it'll all settle down
Right,
quite
marvellous.
nicely.
Thank you very much for your help.
Cheers, thanks. All the best.
Have you had any thoughts about losing weight or how?
Yes,
how
I have.
What are your thoughts?
I've been to Weight Watchers. I lost nearly 3 stone.
Okay, when was that?
A while back.
Right. But a healthy diet would help reduce your need for the insulin.
I need to lose some weight.
Yeah. Now I'm going to go into full lecture mode, so just bear with me 1 second.
I know what you're saying.
Yeah.
Please don't give me a lecture.
No.
Because I know all about it. Been to
Yeah.
Weight Watchers, Slimming World, I know all about it.
But we have programs that you don't have to pay for that we can refer you to.
I know what to do.
Yeah. But there's free exercise programs that we can say you don't have to pay.
And now do I get the breath to do with those then?
Well, you build up slowly until your breathing gets better.
No, that's all I wanted to know.
Okay,
Yeah.
okay.
I'll have to lose some weight, yeah.
Tell me what you're thinking when I'm talking like this.
I'm thinking I know what I've got to do, and I don't want to do it.
Yeah, fair enough.
I mean, you can send me in all the courses you like. I know what I've got to cut out, how much I've even got the scales there to weigh my food, my potatoes.
Okay.
So I know what to do, so there's no point, is there?
And do you mind me asking you what's stopping you from doing it?
No, I've got a sweet tooth. I enjoy my food.
Yeah. It's hard. I
know
find
it's
it hard
hard,
as well.
yeah.
Okay, as always, we don't need to do very much with your insulin because you seem to manage that very well yourself.
Yeah.
Your liver and your kidneys are working well. Your
Good.
cholesterol is good, 3.5. Your
it's not
urine
bad,
test is good as well. So I'm pleased with everything else.
Yeah.
So we just need to work
It's just
on
a
that.
matter of...
Willpower.
It is, that's what it
Willpower,
boils
isn't
down
it?
to.
Yeah.
You know, can hear the ice cream bell and I think, ooh.
Yeah. I understand. I have to have the same conversation
You see,
with
the thing is,
myself.
I've stopped getting in now.
Okay,
You
that's
know,
brilliant.
Takeaways finished, ice cream finished, puddings finished.
What puddings do you make?
I just make homemade ones.
Like what?
You know, like apple and rhubarb crumble and...
Custard and cream. And
God, that is tempting. It'll be gone next time.
next time you see me, I shall be
Dancing in,
9
slim and
stone.
trim. Right.
Okay.
Lovely to see you.
Nice to see you as well.
Right, thanks very much.
Thanks a lot,
Nice to
Doctor.
see you.
Right, and nice to
Cheers.
see you as
Take
well.
care.
Thanks
Bye-bye,
a lot.
bye-bye.
Bye then. Bye. Hello. How can I help?
She's been having quite a lot of reactions, quite nasty allergic reactions to something, but don't know what. And she keeps coming out in like these little spots all over her face or everywhere. But she's having black poos,
Okay.
and it's.
You brought some.
I have, yeah.
Okay, that's all right. We'll have a look at that as well.
She's
That's very
literally.
helpful.
She had an allergic reaction to a nappy yesterday, and just before she had those poos,
Yeah.
literally from head to toe, she comes out in them. It's like that.
And has she been poorly or
No,
anything?
no,
Has
she's been fine.
She's
She
been
had
fine,
sickness
yeah.
bug, but she's had these for quite a few months.
And she's not had any temperature. She's her normal self.
Yeah.
Feeding fine.
Yeah.
Passing urine okay as well and
Yeah,
everything.
yeah.
Okay.
She's been a bit cryy,
Crying.
but her belly does tend to swell.
And that's when she.
Yeah, she gets quite irritable about it.
Right, shall I have a look? I'm just going to check her temperature. Oh, I'll put it back. Oh, bless. Shall we just have a look at the nappy first? Yeah? Okay. Right.
Hey, Baba. Hey.
It does look really black, doesn't it?
What are you crying for? What's up?
My main concern at the minute is her, this poo that is quite black.
Yeah.
Okay? Right. Oh, I'm so sorry. Can I just quickly check your temperature? Oh, bless. Just gonna...
Baby girl.
She's normally a happy child or...
Yeah.
She's just not been feeling well, is she? Oh, bless. Can we have a feel of your tummy? Yeah? Just a bit quickly. Yeah, we'll do that over there. We'll do that when she's... Yeah, okay?
I'm with you.
I'm sorry. And can I see her nappy area as well? Let's get some looks. Right, that's fine. You can dress her back up. Right, like I said, from her skin point of view, the amount of reactions that she is getting, they do sound like allergic kind of rash.
Yeah.
So that's something that definitely needs looking at, okay? Yeah. I think I'm going to speak to one of the pediatric colleagues at hospital,
Right.
okay? I've just run it by them and see what they say. Right. Are you okay to wait in the reception area? Let me give them a quick phone call and we'll get you back.
That's
then.
fine,
Okay?
thank you.
Hi, my name is Dr. Hassan. I'm one of the GPs ringing from Ridge Medical Practice. Just ringing to refer a child to you, please, because she's noticed some black-coloured stools last night. But I'm just a bit concerned, you know, where's this? Yeah.
What I can tell you about working here is that you will never be bored.
And often when I'm driving to work in the morning, I'm thinking, I wonder who I'm going to meet today.
How come you two have got the same top?
Oh, because it's the uniform.
Is that being on? I love having regular patients. It's like seeing your friends.
Say ciao.
Ciao. Ciao, ciao.
Look who I've got, Debbie.
Are you okay?
Ridge patients definitely put a smile on my face.
You're a fancy little doctor, aren't you?
Well, I think we're two of a kind. And so many of them have this really great sense of Yorkshire humour.
Come and kick you then, can I?
But I'd rather you didn't kick me, really.
He's my best friend, anyway.
Dr. Harris?
No, Jesus.
No. Oh, right.
I've been here now for nearly 9 years, so I've seen babies grow up, I've seen families expand.
You start to build up a relationship not only with individual patients, but you get to know whole families.
He's a really classic boy.
She shoots webs.
Shoots webs?
Yeah.
What do you like the best about school?
Dinner.
That's my favourite time as well.
They make me chuckle, and I hope I make them chuckle.
Is your bikini away for another year now, then?
Bikini, where to take you to? Where you
He's a happy boy.
Sometimes it's just the simplest thing. Patients just saying thank you, that makes all the difference.
I would like to award you a sticker.
Oh, thank you. That effect can last for days or even weeks sometimes.
You've changed my life.
Oh.
No, you have. Dr. Khan, you've changed my life.
Oh, I'll take that.
It gives you a real feeling of self-worth. It's one of the many reasons why I love doing what I do and I love my job.
Hopefully, when they go out the door, they've got a smile on their face and they feel a little bit brighter and happier.
I've got good doctors.
Coming to see you.
That way, Fisk.
Hiya, come on in. Dr. Harris. Hi. We met before. I think we probably have at some point.
We may have done it, so
Yeah,
yes,
we'll have
a long time ago, probably.
Come and have a sit down here.
Right.
How can I help you today?
Yes.
So I'm Dr. Harris, and this is Navdeep, who's with me.
Yes, it's this was
Doctor observing.
right at the back of my leg.
Whereabouts? If you just stand up and turn round, and we might
Yes,
get a
good
better
to
look,
see
might
it,
we?
see it better, yes.
Yeah, it's like a keratin horn, isn't it? So we could just shave that off and get that removed and then burn the base of that. That'll be fine, yeah?
Yes.
All right?
Right,
Good.
yes.
So let's get you comfortable.
Yeah.
So what would you normally be doing today then?
Not much. Well, it's a nice day. I'd probably just go for a walk.
Yeah? And where would you go for a walk?
Probably walk down. I live up Buttershaw, so I'd walk down into Wibsey Park and watch them play bowls for a while.
Oh, yeah.
Yeah.
Don't you fancy playing bowls yourself?
No, I used to.
Did you?
Yeah, yeah.
How competitive does that bowls get?
Oh, very.
I think it does as well,
yes,
yeah?
Yes.
All these old people, you can just tell they're getting really, they're getting really nasty with each other.
Definitely.
So, are you OK for local anaesthetic injection?
Yes.
This is the painful bit, it'll sting.
It does sting, will it?
OK, just bear with it. Little scratch, well done.
Ooh.
Great.
Yeah.
How does that feel?
That's OK.
Feels OK.
Yeah.
You still OK there?
Yes, I'm fine.
If you need a breather at all, just tell me, won't you? Looks as though we've got the route as well.
I got a taxi down this morning.
Oh, did you?
Yes, yeah.
We'll just put your dressing on and then we'll review it in about 10 days just to make sure it's healing OK.
Yes, that's fine.
But I expect there'll be no trouble at all. I'm going to lower you down now.
OK. Shall I leave the dressing on?
Well, keep it dry for a couple of days.
Yes.
The thing I just don't want you to do is catch it while it heals.
Yes.
I'll send you a letter about what we found on the under the microscope.
Right.
So it's all action, isn't it?
It is, isn't it?
Yeah. Right, all the best.
Oh, lovely.
OK, take
Lovely.
care then.
Thank you very much.
Thanks.
Thank
Bye-bye.
you.
Bye-bye.
Bye.
Right, Bab. Come on, princess.
Come in. Hello.
Hiya.
Hi. Right, Mum. So, spoken to the pediatric doctor in hospital.
Right.
Okay. They will see her now.
Right.
Okay.
Do you know what it could be?
It's difficult for me to say. Okay.
Right.
So it could just be nothing. Okay. It could just be because obviously whatever we eat also gives colour to her, poo as well.
Yeah.
Okay. And considering how well she is, I'm not worried that it's something sinister or anything like that.
Right.
But still, it is concerning enough for me to have them have a look and make sure everything is okay. Is that all right?
Right, that's
yeah?
fine.
Okay?
Yeah, that's fine.
There you go.
Thank you very much.
Thank you very much.
Thank
Take care.
You too. Oh, thank you.
All right, thank you. Bye.
Cheers. See ya. Come in.
Hello. Hello. Take a seat over there. Now then, what's your name? Libby. Hello, Libby. Who's this fella? Daddy. Your daddy? Hi, Daddy. Well, my name's Debbie. So you're Libby May. What a lovely name. Now, what's the problem?
Well, she used to have eczema in her arms and everything, but then I managed to sort it out. The creams and everything that I used weren't working, but Vaseline started to work and it used to get rid of it. But then she came out with chicken pox and loads of chicken pox.
Yes, last month, she had it.
Yeah.
Oh,
But
darling.
she's been scratching.
Yeah.
And it's got really bad everywhere now.
Oh, Libby.
Last night, she keeps picking at it as well.
Yeah.
So, but last night, she'd scratched it that bad, it were all, like watery.
Let's have a look at this one as well.
It's all down her arms and everything and on her hands now.
Oh,
Look.
sweetheart. Can you take your top off and let Debbie have a look at you? Ooh. Oh, are you good? Or is it a bit stiff on your head? Has it got buttons?
I don't know.
Me and your dad are as bad as each other where dresses are concerned, aren't we? Darling. Here, leave it round your neck. Right, come here, let me look at you. Oh, you're sore, aren't you? Take your temperature, this goes in your ear. It's not uncommon when they've had chicken pox for their eczema to really flare up. We'll have to get you back on all your creams and that, won't we?
See, they didn't really help. She's even been on the steroids and everything.
Come here, I want to listen to your chest as well, because you're coughing, aren't you? You got a bad cough?
Yeah, she has. Really bad.
You're still smiling though, aren't you? Turn round, my love. That's a nice ponytail. Right. Don't tell your mum that me and your dad don't know how you do your dress, will you? Your dad might get in a bother.
She couldn't see her mum. I've got custody of them.
Have you?
Yeah.
Just her, or has she got some other children?
2 girls.
And how are you doing?
All right.
And how old's your other one?
7.
And do you get any help? Does anybody help you?
I've got another girlfriend.
Right. She's lovely, isn't she? Have you got any sore legs, Libby?
No, not about legs.
Right.
You do it. I drink, Daddy.
So she's got a flare-up of her eczema, which she knew about. Yeah. Don't worry about it because we can get on top of it. She's also got a temperature and she's got a few little crackles in her chest. It's possibly a virus because she's got a really snotty nose and everything.
Constantly.
She's constant runny nose.
Never can get rid of it.
I'm going to give her some antibiotics because her skin needs some antibiotics where it's really red and sore. But I'll give her an antibiotic that if there were any chest infection, it'd treat that as well. Okay. I'll give you all the creams, we'll go right back to the beginning, and then we'll see how she goes. Is that all right?
Yeah, that's fine.
Do you like coming to the doctors? Do you like it? So I've put the moisturiser back on repeat, and so every single month you can get that, right? So never wash her in soap. Stand her up or shower her and get it on your hand and just make it like a soap and use that to wash her.
All right.
So we use that hand.
I've never been told that before.
Come to the right woman today. And 4 times a day, moisturiser all over. Everywhere where she's sore, this is a steroid cream. And it's a moderate steroid, not for her face at all, but all them sore parts here, put that on twice a day.
Okay.
Okay? And then that's some antibiotics, which I think she needs as well. And I think her skin should get a lot better. She should be fine by next week.
Okay.
And are you going to put your cream on? You're going to help your daddy? All right, then.
Come
What
on in.
beautiful manners. Bye-bye. See you later, darling. Thank
See
you
you
very
later,
much.
thank
You're doing
you.
a lovely job.
Thank you.
See you later.
Over the last year, I lost my dad, my nan, my uncle, my best friend.
Oh, goodness, nice. That's tough.
I think as a GP, we go through a lot with our patients. We have a lot of deep and meaningful chats with our patients.
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I do.
So, I mean, that's a lot of stress, isn't it?
Yeah, and I don't talk about it.
Yeah, yeah.
I particularly remember having to break bad news to a lady who was only young, with children who had cancer everywhere.
He'd been in hospital before, you bring them out. And this time, he went in and he didn't come out.
She died a couple of years ago now. But
It can be quite an emotional roller coaster at times.
When that's happened, it can put it's a dampener on your day. You know, you need your spirits lifting a little bit because it is sad, but unfortunately, it happens.
she'll always be a challenge, that lady.
Good morning. Have a seat. I'm Becky, one at Nurse Practitioners.
Hi.
Hiya, how can I help today?
The thing is, I've been having problems eating till I get a breakfast in town. It goes right through my system. It gives me diarrhea every time.
OK.
And I've been out for the last couple of weeks.
OK, so have you had diarrhea every day for 2 weeks then?
Yeah. Till I pass urine, it smells horrible.
OK, so
It's
you've
horrible.
got smelly urine as well?
Yeah, I've had it for a long time.
How long have you had the smelly urine for?
Too long.
For a long time?
Yeah.
And how many times a day are you having the diarrhea?
It's every time when I go for something to eat, like a breakfast in town. So I have a breakfast every morning, see, in the cafe.
And what do you have in the cafe? Is it like a fried breakfast or...?
Egg, bacon, sausage, tomato and beans.
And you've eaten in the cafe for a long time, have you?
Yeah, I always have a breakfast in the morning.
And have you been travelling anywhere or done anything different?
No, not really, no. I went down to my mum's 2 weeks ago to arrange for a funeral.
Oh, dear.
I lost my brother.
Oh, so you've had a rough time of it, haven't you?
I lost 2 husbands. One uncle, 2 cousins, and my dad. It's gone all wrong.
Yeah.
It's gone all wrong.
Yeah.
I don't think it's possible to work in primary care, really, in a GP surgery without that sense of team spirit.
Do you have anything that needs doing, taking out?
I could probably do some exercise. Do you want to just run me around a bit?
Oh, I don't do that myself.
You'll get your reward in heaven.
I'm going to heaven anyway.
Yeah, I'm not.
People who start as colleagues often end up as really good friends.
Would you like one of my tomatoes?
Are they
Do you like
homegrown?
tomatoes?
Yeah, I do. I do.
Have a couple.
Small is beautiful. Who's making your wedding cake, Amir? Me.
Have you ever made a wedding cake before?
No, I can try.
We do all get together outside of work from time to time.
Are you coming to our night out then?
I probably will come, yeah.
I go to the gym with Dr. Chris Harris every night of the week, pretty much.
Hi.
Cheers, mate. No, it's nice to see you.
The cheekiest person who works here is definitely Amir.
I think everybody's noticed that.
And his partners in crime tend to be Debbie.
Is he there?
Yeah.
Right, get out.
And Karen.
Karen!
They all have a good sense of humour.
Yeah, they do, and make our days go a lot quicker.
We have lots of fun. We work really hard, but we don't take ourselves too seriously.
And I think we go through a lot together and quite highly emotive times, and I think it's such a fantastic supportive team here, and that brings us all closer together.
So, how are you doing?
I'm all right.
Yeah. So, last time I saw you, you mentioned that you had a problem with your finger and it kept getting stuck.
Yeah,
when...
they're both getting stuck.
Does it hurt anywhere?
It does hurt.
Show me where.
Mostly all my fingers, there.
Yeah.
About there, look.
Okay.
And about there, look, and that there. That hurts.
Can I have a look?
Yeah.
Is that okay?
The big finger there. Trigger finger.
So just make a fist and then in again and then out. Okay.
It's not there.
Yeah, I can feel it.
And I've got one there and all.
Do you know what trigger finger is? Do you know
No,
what
I don't
happens?
know.
Okay, so in your hands, you've got these tendons that move your fingers up and down, and they move within a sheath, really. So it should be a nice, smooth movement like that.
Yeah,
But sometimes, sometimes
Yeah.
the sheath gets tightened around the tendon, and it's not easy for it to move back and forth.
And it locks then,
And it
doesn't
locks,
it?
yeah.
I know that part, yeah.
Yeah. So what we're hoping to do today is pop a little injection into where the sheath is, where it's got tight, and put a bit of medicine in, some steroid, to try and reduce the inflammation and try and release it so it goes back to being a nice, smooth movement again. So if we can just move you across here a little bit, and if you just turn your hand around, I've got to say, you're the smartest man I've seen in a long time. You're so well dressed.
Oh, thank you. I'm too good for Leeds, and I'm too
good for Leeds. Right, you're just going to feel a sharp scratch now, okay?
Oh,
and it'll
right.
just be a bit sore.
I'm used to them.
Sorry, here we go.
I've had loads in the hospital. I've had needles in my head.
Needles in your head?
Yeah.
What was that for?
Oh, that's because they found some cancer under my eye. I still got a scar. Yeah. They got it all out. So I said, and then later, if you lost your eye, I've only had one eye.
Oh, bless you.
That's all done. It might not get better for a few days, but it should get better. This time next week, it should be feeling a lot better.
Yeah.
And I'll send you out another appointment to do the other side, probably in about 2 or 3 weeks' time. Is that all right?
Yeah.
I'll say goodbye, but I'll see
Goodbye.
you again for the other side, OK?
I'll help you up, yeah?
Yeah. Oh,
You okay?
I'm all right, I'm all right. Yeah.
Right, well, there's your trolley. I'll help you with this
Oh, you
outside,
see,
okay?
I forgot to tell you, I was a role model a couple of weeks ago. I walked on the stage and I got into the final,
Uh-huh.
but I didn't win.
It should have been you. I'm sorry.
I know, it should have been me.
I know. It's not good, is it?
It should have been me. Like that song.
That's fine. Do you want to come behind the curtain? Can you give me a cough? Can you pull your tummy in and push it out? That feel okay?
Yeah.
Yeah? Thank you. I'll have a little feel. I'm really sorry, my hands are always cold.
That's right.
I suppose the only other thing that we could do this morning that we haven't done yet is have a little feel into your bottom. So if you lay onto your left-hand side, facing the wall, that's it, and then draw your knees up to your chest, and then you'll just feel some cold jelly on my gloved fingers. Is that all right?
That's fine.
OK, lovely. That's fine. Well done. So your tummy feels fine. You've no high temperature at the moment. OK, that's good. This could be a bit of a bug that you've got, although it's gone on, 2 weeks, hasn't it?
Yeah.
So I want to do a couple of poo samples, OK,
Yeah.
for you to do. And then I want you to get some bloods done this morning.
That's fine,
Is
yeah.
that all right?
Yeah.
Do you think you'd be able to go home and have a cup of tea, and we need to get plenty of fluids into you?
I will do, yeah.
Yeah, OK, and make sure that you're weeing regularly.
Yeah.
We'll send that urine off as well, OK? If your pain and everything gets worse, I need you to come back sooner. The blood results will be back by the beginning of next week, OK? And I'm just going to sort out for somebody to do your bloods now. All right,
OK,
so
yeah.
you can put them in your bag. So have a seat in the waiting room.
Yeah.
And you'll get called through shortly to have a blood test.
OK.
Is that all right?
Yeah, fine.
Yeah. You take care.
Yeah.
We've had a message from the health visitors to say that you've been concerned about his arm, actually.
Yeah.
So tell me what you've noticed about his arm.
Right, his left arm, it's always, at the back of him, and he's constantly got his fist clenched.
Right, and that's been ever since he's been born?
Yeah.
So tell me about his birth. Did you have a normal delivery?
He was born by emergency caesarean.
Right, and why was it an emergency? Did he just not progress?
It was planned to be delivered by caesarean anyway.
Right,
because I'm insulin-dependent diabetic.
Fine. So is he your first baby?
No, it's my third.
Third. And you're worried about his left arm?
His left arm, yeah. When I hold him, it's always, at the back of him.
Right. let's strip him off and have a little look at him on the bed.
His nappy.
Yeah, that'd be good, because then I can listen to his chest and check his lungs and everything as well.
Let's strip you
Do
down,
you smile
darling.
nicely?
He does.
Do you smile at your mummy? Hey? Hey? Are you going to smile at me?
His muscles, you know, she said, more like...
We've got a bit of...
Oh,
you're
you're being sick, darling. We've got a baby here.
There you go.
It's because he's just been fed.
Has he? Oh, dear.
Oh, for loads of bibs, don't we, darling?
Oh, yeah.
He seems to have more muscle at his side than this one.
Can you turn him away from me again? We'll just see. Is he smiling at that? He's not crossing.
No, he's not.
Moving his...
I mean, he does use it, but not quite as much as his right one.
I can't really see that there's any muscle wasting on that side. He's really active with that arm. But what you're concerned about is the positioning of it being behind his back. Has the health visitor actually witnessed it?
We tried putting him on his tummy and he just won't do it.
Should we try that? Let's try him on his tummy on here.
We don't use them that, do we, baby? I can't use one, can we?
Why not?
His arm goes really, really stiff.
We're not so keen on tummy, are we? Oh, do we not like that?
We don't mind it, actually.
Do we not like that? Do you mean like that?
Yeah.
Oh, darling, pick him up now.
And he just don't... Why, darling?
So you didn't mention it at the 8-week check. Had you not noticed it at that point?
I hadn't really noticed it at that point, but when I was pregnant with him, on his scans, they did say that there was a possibility that he wasn't going to be born with one arm, because they couldn't see his arm on the scans. I mean, I didn't find out I was pregnant until I was 23 weeks. And I had my scan at 24 weeks, and that's when they noticed that I was really going to have one arm.
That's interesting, isn't it? Maybe he was in the womb in a funny position with his arm. I think probably just leave it with me. I'm going to just check with one of my colleagues to see whether there's anything we need to do about this. It might be that we ask the paediatricians to have a look at him.
Yeah.
Leave it with me and I'll give you a ring in the next few days. Is that all right? Yeah. All right. OK. Bye-bye. See you, bye.
See ya.
One, two, three, it's good to be me.
Come in. Hello. Hi. Is it
Morning,
come in?
how are you? All right?
I'm good, thank you. Come in, have a seat.
Good. Morning, girls. You all right? Good.
Come in, my name is Dr. Hassan. I've got a couple of students with me as well. Is that okay?
Yeah, that's fine.
Right, okay. What can I do for you today?
I keep collapsing.
All right, okay.
I think it's my cartilage what keeps tearing.
Okay.
I've been down to physio for the last 3 weeks and it's not doing out. Last week, I was in that much pain, I couldn't go to work.
So all in all, how long has it been going on for?
3 or 4 months.
3 or 4 months. So you were fine before that?
I was just fine, and just all of a sudden I can just walk down the road and I'll just collapse, my knees will just give way.
What do you do?
I'm a chef at a hotel.
So how are you managing with your work?
I just have to hop around and hope for best.
Are you taking anything for the pain at all?
All I've been doing is taking paracetamols.
Can I ask you to come over here?
Yep.
You're going to have to lower your trousers for me to have... Are you wearing boxers and things, yeah? Let me just... Are they okay to join in?
Yeah, that's what they're here for.
Yeah.
No good hiding behind the curtain if they're not going to learn out.
So if you just lay down for me, just relax back. Okay. So whereabout does it hurt? Does it hurt on the front or on the sides?
Sometimes it's this side, and sometimes it's there.
Okay.
And I get a shooting pain.
That's painful.
Yeah. Whoa.
It's painful at the back as well?
Yeah, that is. Okay. So is that.
Oh, I'm sorry. I'm sorry.
One of the things I love about being a GP is it's so unpredictable.
You never know what's going to come through your door.
I was asking a patient about whether or not he smoked. He said, oh, on a good day, love, I'd have 40, 50 cigarettes. And on a bad day, thinking, oh, it must be 100. And he went, oh, no, on a bad day, love, I'll only manage 20.
A man came in who had a really big sebaceous cyst or a big skin tag. It was rather large. He then decided he was going to keep this skin growth because he'd named it Paul and he wasn't quite ready to let go. He ran out of the clinic, basically, and we never saw him again.
I used to work overseas, and as part of that, I was learning the language. I thought I was asking the patient, is your poo slippy, runny? But what I'd actually said was, is your poo tasting sweet? And everybody fell around laughing.
I once had a consultation with a lady who came to ask me to amend a sick note because she wasn't happy with what the short, bald doctor had written on the sick note. And I let her ramble on, then I said to her, you do realise that short, bald doctor is my husband?
So I was once fertling around in some chap's groin looking for a hernia. And part of the examination is you ask the patient to cough. I normally say, give me a cough, but instead I said, give me a kiss. And his face was a picture.
There we are.
Hello, ladies.
Hello.
How you doing? All right, Syra. Look at you, all big now. How you doing, Sada?
Okay.
Come and sit down. How was your scan?
Scan was okay.
Yeah. Boy or girl?
Don't know yet.
Do you know? No.
My instincts are, this is going to be a boy.
I have a feeling you're having a boy as
Do you know
well.
what? Everything's totally different.
Yeah.
Everything is different.
Yeah.
Let me tell you on my birthday.
When was your birthday?
16th of September. Oh my God. I'm 9 now.
Congratulations.
What did you get?
I got makeup, I got nail polish, I got a
Makeup and nail
iPad.
polish.
Ooh.
Malika, can we have a little talk about things?
Yeah.
Is that okay? Your mummy went to see Dr. Knight, who's your heart specialist as well. Were you there?
Yeah.
Yeah, can you remember what he said?
No.
No. Should we just have a little talk about that?
Okay.
Is that all right? So sometimes when your heart is poorly, it means the lungs have to work harder to get all that oxygen going round your blood, which is why sometimes you go a little bit blue and your oxygen levels drop. And some people thought it was because you weren't getting enough air through your throat, and some people thought because your heart was poorly and it wasn't working. And we all now agree it's not because of up here, it's more because of your heart and the poorliness in your heart. We were hoping that when you get a bit older, they were going to do an operation on your heart, but because your heart has made your lungs poorly, we now have to wait a bit longer until your lungs get better, and then we can do that operation on your heart. So we might be waiting a few years before we can do it.
So we have to wait a few years until my lungs get better. They're going to do an operation on me, then my heart gets better, and I'm like everybody else.
Well, you already like everyone else.
I'm not.
You are. You're special.
I always in hospital with mummy, and nobody else gets to spend time with mummy. It's just not fair.
I know, but you get lots of other nice things as well, don't you? And we're all looking after you, as you know. How do you feel about that?
I don't know. That was so much.
It's a bit complicated, isn't it? Even for us, it's hard.
Yeah.
So for you, it must be really hard. But all you need to know is that we're hoping to get things better sooner, but we're just going to wait. So it doesn't mean you're going to be more poorly. It just means you're going to be waiting longer for that heart operation that we were all hoping for. So why don't I arrange to see you again in a couple of weeks after you just have some time to think about it?
Yeah, no, that's lovely. Thank you so much.
That's it. Shall I try and get you in before the end of this week?
Yeah, please.
I'll sort it out.
No, that's fine. Thank you
All
so
right.
much. Thank you.
Take care, darling.
Right, thank you
All
very
right,
much.
thanks. Bye-bye.
Bye.
Just press that button there on the left.
Oh, yeah, we've got...
And then you go out that way.
What is wrong with Malika's heart?
So she was born with everything the wrong way round,
Right.
which often isn't a problem, but she also had lots of narrowings in her major blood vessels and 2 big holes in her heart as well.
Wow.
So everything was going round the wrong way. So low oxygen levels, heart murmurs, going blue. And so she's waiting for this Fontaine procedure. They've written in the notes that they're going to keep an eye on her lungs and wait for her pressures to come down.
Yeah.
So,
It must be so hard.
I know.
Poor little love.
Come in. Any problems I need to know about?
I don't think so. I did have some fluoxetine a while back.
So stopped how long ago?
About 3 months.
And you're okay?
Well, I was taking it because I don't want to go on to HRT. And I found that I was having some menopausal rages, particularly with drivers. And it was impinging upon life. And it helped, it really did help. But then I thought, do you know what, I've got to get a grip. I've got to, you know, try and conquer these feelings.
Because they do tend to try that first now, don't they?
They do, yeah.
I tried it.
It was really surprising, you know, and gosh, it worked. It was great.
And it didn't do for me.
But I thought, well, you know, now I actually know what it is, I can deal with it a bit better. Instead of having the stress and the pressure and then thinking, I'm losing my mind. Yeah, it worked. So I thought, well, now's the time to try and wean myself off it. So I didn't stop straight away.
Yeah. I think you can go somewhere like Menopause Matters. I tried it, I tried without it, I tried with it. It's so much better with it.
Is it so?
I'm just going to move this knee for you. Just relax again. Does that hurt?
Yeah.
On the inside? Okay. Now just keep it there for me. Right. That's fine. Come back. Okay. Good stuff. I'm thinking, you know, after examining you, it's painful in literally every direction, every movement, but you're not able to move it completely.
No.
I think we're gonna have to get you seen by one of the specialists who deal with kind of knee problem. They're called MSK people.
Yeah.
Okay, so I'll send them the letter. I'll do a prescription for you for some gel.
Yeah.
Okay, you can rub it 3-4 times a day.
Right.
And that seems to work really well, especially for knee joints and for hands. Okay.
When I worked, they asked me if I could get a sick note for last week because I took all week off because I was in that bad of pain.
Right.
I end up crying with it. It's not like me to have tears in my eyes.
Right, no problems. So that is your sick note.
Take that working tonight.
Okay, and let's take it from there. Okay.
Okay, thanks very much. Thank you. Hopefully we get something done.
All right.
Right, thanks a lot. Yeah,
bye.
Have a good day. Try not to work too hard, girls. See you later.
Mum will do your weight. Okay, 83 is 13.1. So this is where you are. Okay, BMI 35. So any reduction is going to be good.
Well, on the plus side, I am going to the gym.
Very good.
Which is very recent. But on the poor side, really, it's just piled on. And I've gone bigger apple. I'm kind of, you know, super-size apple now. So what can I do to get my cholesterol down, then?
We reckon reducing saturated fat, so anything that's solid at room temperature, your butter, your lard, your cheese, things made with that, so pies and pastry. If you like cheese, I'd normally say go for a really strong cheddar and grate it. So you're getting the taste, but you're not getting as much. So we probably just need to see you every year around about your birthday. So just before your birthday, think it's MOT time. All right?
OK, I
So this time next year, you're doing OK.
But I might be thinner then. I shall see you when I see you. OK, I'll take this with me.
Yes, so we'll see you October.
October. Cheers.
See you later. Bye.
If I could describe working at the Ridge in one word, it would be...
fulfilling.
Immense.
I want to say...
interesting. Working at the Ridge is like one big adventure. Lovely.
In a word, I think it would be perfect.
Can be frantic.
Stimulating.
Loud. It's always loud.
Busy. There's never a dull moment.
Life-changing, but that's two, sorry.
Could never describe working at the Ridge in one word, I don't think.
Yeah, that's probably the best answer, yeah.